In this video, I'm going to explain to you how interventional radiologists can help patients with knee osteoarthritis. Knee osteoarthritis is a very common condition, especially in the elderly, and it happens when the cartilage in the knee wears off and essentially your joint is not working as well. It's basically wear and tear in the joint. Traditionally, knee arthritis is initially treated with conservative measures like physical therapy or injections like a steroid injection or injection of PRP or hyaluronic acid. But these injections only go so far, and ultimately, the best way to treat knee arthritis is with a knee replacement. A knee replacement is a big surgery that has a long recovery time and requires a lot of physical therapy. Also, some patients may not even want a knee replacement, but some patients may not even be candidates for a knee replacement because they are too old or they have multiple medical conditions. And I've been doing interventional radiology for almost 20 years, and I haven't done anything for knee arthritis until about 5 years ago when two procedures came to the spotlight. Genicular artery embolization became interesting to physicians because they realized that there is a lot more to knee arthritis than just cartilage damage. There's also a lot of inflammatory changes that actually make the damage in the cartilage worse. The way it's done is we insert a 2mm catheter, usually to the groin, either the same groin or the opposite groin that we're planning to treat. We then navigate the catheter all the way to the knee joint, and there are several arteries going to the knee joint, and we try to find all of them. We then insert an even smaller catheter into these arteries called a microcatheter, and through this microcatheter we can inject these small beads. They're small spheres, microspheres, that will block the blood flow going to the knee joint. The other procedure we can do, it's called the Genicular Nerve Ablation. It's a different spin on the topic. So there are essentially three main nerves that are going to the knee joint, all innervate and are responsible for the pain around the knee joint. They don't have any motor function, so there are nerves that are not completely necessary and they can be ablated. Now, the nice thing of genicular nerve ablation is that it's a procedure that can be tested before we actually perform the procedure. Although traditionally the effects are not as durable as the genicular artery embolization. On average, the patients get relief for 6 months to a year, but this procedure can be repeated as many times as it's working. The good news is none of these procedures burn any bridges. So if they don't work, or if they worked and then they stop working, you can always have a knee replacement later. It doesn't make the procedure any more difficult or make you less good of a candidate for a knee ablation. This is Minimally Invasive Insights, and I'm Dr. Fabio Komlos.